Hi, my name is Mahtab Moradi. I'm the Director of Behavioral Health Services here at Ibn Sina. And today we have my colleague, Umer Virk, who is going to shed some light on men's mental health and actually, in general, men's health. And today we're going to go over some kind of hot topics that uniquely impact men to celebrate men's health for June. Tell us a little bit about yourself, and then we'll kind of dive into more specific questions about.
Yes, I'm very excited to be here. My name is Umer Virk. I am a psychiatric and mental health provider here at Ibn Sina, and I'm very glad that Ibn Sina is bringing that awareness to the men health and specifically men's mental health. We need to talk about it. It need to be discussed. And I'm excited to be here. Let's jump into it.
Okay, so you ready to represent all men?
Yes.
Okay,
probably.
so the first thing I kind of want to hear your response to is why is men's health important, and what are some key issues that go unnoticed?
Yes.
And I want you to start with mental health because I know a lot of men often underreport or don't even report their issues around that.
Yes, and that's very, you already started a good point here. First of all, mental health is relatively a new arena. People are start talking about it, and then men's are even lagging behind from that perspective. Mm-hmm. For example, there are so many layers of men's mental health. Number one is we always hear just man up. For men it's very hard to report due to the social pressure, stigma, because men are supposed to be strong creature and we need to be man up and not say anything. Although emotionally men feel the same way as any other human, any woman, right? So for men there are so many layers to be go underreported. For example, when they're expressing their feelings, they are not telling you the 100% they feel, because in the background they want to come off as a strong, even they are not wanting to be, but that's a social stigma is there. They cannot show their weakness, so they're underreporting symptom even if they're going through. Number one.
Yes.
Number two, men are more likely to hide those symptoms with the substance abuse. Actually, men are more likely to abuse different type of drugs. So those
kind of
symptoms
masking
them, self-medicating them, and not show up on the surface. Number three, of course, health, a lot of time when people are working, people are like living their lives, health is not something on the forefront of that perspective. They're not even going to see a doctor. When they're gonna see somebody, they're gonna tell somebody.
Yeah, even with physical health, a lot of times with men's health, they wait until
last minute,
they have a heart attack and then they find out. Whereas I think as women, we're very hyper vigilant about our health. Maybe it's something like you said, it's cultural.
Pick up symptom very quickly. Women they're more like easy to palpate those down underlying issues, and sometimes they open up. For men, they're like, we'll look at it. It's more like a nature of the man. Let it go. Again, not every man, but mainly that's what the problem is. So when it comes to mental health, I think it's more like a social stigma. Like if I say I am depressed or I am anxious, people will feel me as a weak man.
Yeah.
So that they don't open up. And mental health was not a thing. If you look at a few years back, it was in our elder population. They would never go to doctor. They never talk about mental health. And now finally with the social media and the awareness of mental health, people are talking about it.
We're more aware, that's for sure. And I think I want you to go into a little bit more with that, because I think you have a very unique and good approach on how you assess both the mental and physical, and not just with male patients, because I've referred you plenty of female patients, but what is it about your perspective on your own mental health that kind of makes you a more effective clinician or a provider when it comes to picking up those cues?
Yeah, so a lot of time people don't understand our physical health and mental health are very much so interlinked. They are actually the first time, a lot of time when people picked up for mental health, they come for something physical symptom.
Yes.
Very often, I have many time, I have patient just with the complaint of insomnia. They just come, I'm not able to sleep. And that's a starter point. and you go deep into that, why you're not able to sleep, you keep asking more and more questions, you end up in full depression. Like, it's a depression that is causing them to not sleep, right? So that's why, and I am, as a provider of both mental and physical health, I look at patients actually when they walk in. My goal is to look at them as a whole person and try to find out what is actually causing them. And for example, in depression, one of the symptoms of depression is a lack of sleep or too much sleeping.
Yes.
So sometimes one of the symptoms of depression is just lack of energy, lack of motivation. Sometimes people come to me just with the same symptom, hey, we are very tired lately. And then boom, we can start from here. We are going to address the medical aspect of it first, like what medically what can cause those problems, and psychiatrically what can cause.
What are some tests that help you make that decision between, like, when someone needs the medical attention first? Because sometimes patients will come in, like you said, with one symptomatic reporting, but the real thing is something else. So what are some common tests that you order as a provider?
So always, it's like a rule of thumb. We can always use that. We always try to rule the medical causes first, of course. Like, for example, if you have a low hemoglobin, you have a low red blood cell in your body, you can feel tired, you can have a shortness of breath. So yes, we will always, even we feel like it's a psychiatric issue, we always try to deal the medical first. We do their complete blood count, we do their thyroid test, because thyroid can cause tiredness and cause depression as well in some people. So, and then we do their cholesterol panel. We do their depending upon if there is a man. Well, we are talking about men. So we do more testing. Like, for example, we can do the prostate screening test, or we can do the
they have hormones too, right?
Right. And or we can do the HbA1c that tell us a control of your sugar, because if you have a high sugar, that can make you tired as well, or you're ending up going to bathrooms, or it's messing up your sleep because you're waking up too many times to go to bathroom. So it's a systematic process. So we deal with the medical aspect first, and if we feel like medically we are satisfied enough, there is not much going on, then we probe more in the mental health of it.
Okay. So what I want to learn a little bit more about, as resistant as men are with just even speaking up that they have emotional pain or they're under distress, how do you approach the talk about, getting someone the help, maybe getting on medications? Are there medications that work better for men versus women? Like, what's been your observation and experience?
So the very important thing is when men come for mental health, just like I said, it's hard for them to open up. So first of all, you have to build a rapport, and in a non-judgmental way, not just medically. You have to be kind of give them space and ask them, instead of investigating them, just ask them, tell us what are they feeling. Ask them how life has been, if job has been stressful, if your relationship has been stressful. Try to go around the factors that possibly causing those problems. Are you financially okay? If your job is paying well, are you able to support your family? So start with the basic ones. We always go with it, because a lot of these social aspects do affect your mental health. So build a rapport, and they will open up eventually. Because if you are going to judge them straightforward, yes, of course it's going to be hard for them to open up. They already are in a different position to give you information, and then you're trying to probe and investigate. That's not going to work out. I rarely have, of course, I always have some cases that are hard to probe into and get information, but most of the time, when you build a rapport, you talk to them, polite, they will give you information how they're feeling. So it's a technique you have to use.
To that's good. That's good that you have those both worlds covered. One thing I am kind of curious about also is, when problems are not, there's no medical underlying issues, but you had mentioned earlier that a lot of men tend to mask problems, maybe by drinking too much, maybe, like, the big thing these days is sports gambling, addiction. Are there some things that family members or spouses can be on the lookout to make sure that their loved ones are getting the right help? Because I know sometimes with men, the research says that once they reach that threshold of depression and they are suicidal, they're also more likely to, complete a suicide attempt. So can you shed some light on that for us?
Yes. So that's a loaded question. Let's try to tackle it. So from research point of view, almost 20% of American men do deal with mental health issues every year. Not over their lifetime. It's a moving annually. At least 20% of men at any time will have some mental health issues. So, but how many will get help? Number is not clear. Probably 3 or 4%. Not even that. Out of those.
Wow.
Yeah. That's a very very underreported number one. Again, you mentioned about it. The reason for underreporting, because there are so many things available out there. Like THC is there, alcohol is available, vaping. There are different type of chemicals, and if you really dig deep, very few people actually do those things just for the recreational fun purposes. They are trying to hide, for example, if I have social anxiety and I cannot be comfortable in a social place, I will figure it out, okay, what I can do that I will be more presentable. I will try to drink alcohol, and then one lead to another and third and fourth, and you can walk into it, right? Same for the THC. A lot of people just take it actually just to relax their brain. So it means they're trying to mask some symptom to get more acceptable in the community. So that's you're one of the answer of your. That's how they mask, because they want to be self-medicating. They are trying to find something, and then that lead to more and more problem, and they're going to more hardcore stuff to get more into it, right? And then once they get help, again, men are actually less likely to 100% follow the protocol. Sometimes they're easy to follow. If you have a female client, they're more likely to follow a direction and get a medication.
Compliance.
Yeah, compliance issue is there too, right? Yeah. And going back to the family members, that's very important. I think the spouse, the family member, the partner can play a big part here. Because a lot of time people at home knows that what's going on, because they live together, they observe you. Sometimes they overlook on that, and it's okay if somebody is doing something that is not usual, they are not behaving that way. It's okay to ask them.
Yes.
And keep asking them. What's maximum gonna happen? It's gonna be a little bit offended, and you're still together, right?
Yeah.
You're still a partner. That's your responsibility. I actually do always talk to my patients. If they're coming alone, of course, then you don't have much option. If somebody's coming with them, I ask them, what do you think about the patient?
Yeah.
Because for them, they have the best eyes.
They're
observing every day, right? And even sometimes if I feel like I am not able to get some information from some patient, I tell them, hey, can I talk to your wife? Can I talk to your mother? I get their permission, of course, and call them and get information, collateral information.
Yeah.
That's very important for mental health. And that lead to early diagnosis and treatment before you reach the suicidal point. And then I will come toward the suicidal point as well. Actually, men and women both feel suicidal. That's a natural feeling, but men are more likely to complete it.
Yeah.
Women are more likely to attempt it, but men are more likely to complete it, because women are using less harmful means they're basically cutting a little bit, or trying to a little bit overdose. But men are normally using lethal means.
Yeah.
They're using firearms, or
I love that you mentioned the family involvement, because actually in the literature that I'm familiar with, when you use the change model to get patient kind of vested in their care, and you make their positive relationships or their support system also part of their care, they're more likely to have accountability and kind of pull through. So that's very good.
And that's also part of the decision making. When you decide to refer patient for the therapy or medication, I always ask patient, what do you think about it? Because if you get them on board and have them partner to their care and advocate and representative for themselves, they will more likely to follow a direction than you are dictating something.
Yes.
It's just a human nature. I mean, if I feel like I made some decision, I want to stick with it.
Yeah.
Then you are telling me to do something I may not.
I love that.
Yeah.
So if I were to ask you to give us, one take home.
Yeah.
As a man yourself, as a provider, as as someone's partner, spouse, somebody's father, what is something that you want us to hang on to from this very important conversation about men's health?
Yes, so I will recommend a few things. Of course, we are talking about general health and mental health, both perspective. We'll talk about general health first, quickly. I feel like everybody, even if you're not sick, this is a timeline, this is a time we are right now in, is a preventive healthcare system. We have to go for preventive healthcare visits once a year. Go get your basic blood work done, make sure your cholesterol is okay, make sure your thyroid is okay, your sugar is okay. Especially if you are 20 plus, you should start getting those helps, right? Then as you keep getting older, there are more screening you can add over time. Like for example, if you're a man, we're talking about men, so prostate screening. If you're 50 plus, we need to do the prostate screening. If you are 50 plus, we need to do lung cancer screening. We need to do the colorectal cancer is very on the rise even in young people. So we need to do screen for that. There are different ways of screening. We are doing blood screening. We are doing the colonoscopy. We are doing the fecal occult blood, where we check any blood in the stool sample. That screening is important. So these all, so we can catch these things early and treat them, and there's the more chances of survival. So that's one. Every man should go to doctor at least once a year to do basic blood work. But this screening, of course, you don't have to do every year. There are different guidelines. For example, colonoscopy is a once every 10 years if you don't have any risk factor.
Thank goodness.
If you don't have risk factor, right? So the different screening have different guidelines. Number one, that's for the medical point of view. Sugar, very important. Once you are 35 plus, you have to check your HbA1c. That's a basically 3-month control of sugar. So you can keep an eye, because sometimes I seen people, they diagnosed with the sugar like at one point and they already lost their kidneys, and because it has been there for 10 years and there is not much symptom. So screening help you to find them early and treat them early. And then coming to the mental health point of view, of course, the people around you need to observe yourself. You need to observe your own behavior. If there are any changes in your sleep pattern, are you more irritable? Are you not, are you smoking more? Are you using more substance abuse? There are so many factors. And then if it's affecting your life and you're feeling like you need help, then you need to show up and talk to somebody. And the Ibn Sina is the best place to be.
I love that. I think that's one of the things I really admire about the way you approach your patients, is that you're very holistic, and you do a great job in educating so that the patient themselves makes the decision. And just as the men in our lives take care of us, we should also do everything we can to take care of them. And don't be afraid to confront issues that have to do with mental health, because it feeds straight into blood pressure, heart disease, in other chronic conditions like diabetes, because when mental health goes, everything else kind of follows. And you also get to enjoy a more fulfilled family life if your loved ones are around and they're healthy and practicing good habits. Thank you. I know that this was a big topic. We kind of threw a lot of hard questions, but I appreciate.
Any day, and I'm really happy to be here. I hope if people are listening this, they can get help, and we are here. If you want to talk about anything, we are here.
Yes, thank you.